My name is Dr. Shweta Patel, and I am the founder of GAYA Wellness, which is a virtual women's healthcare platform designed to have your convenience and your comprehensive health in mind. Today, I wanted to, in light of the fact that it's Polycystic Ovarian Syndrome Awareness Month, I wanted to do a quick live on what Polycystic Ovarian Syndrome is and how it affects us, because a lot of women are actually experiencing signs and symptoms of this without having a formal diagnosis, and that really leads to a lot of misunderstanding on what causes it, as well as misunderstandings on how to address it. And then there's also the element of how it impacts your quality of life. And it does have a significant impact on women's quality of life as well as their subsequent fertility. So it's really important to make sure that you are you have a clear understanding of what's going on. So as the name implies, Polycystic Ovarian Syndrome is a condition where your ovaries look a certain way on an ultrasound, as the name might describe. But it's a complex syndrome, and it's not just one or two things. It's usually a bunch of things that are sort of tied together that lead to this. And so the textbook definition is when your ovaries look like they have tiny little bubbles on the periphery of them. So if you were to think of it as a plate, and in the center of the plate you put some peas, and they're kind of just like, spread around, but now instead of just letting them be that like random pattern, you're actually lining the plate at the peas at the edge of the plate, and so that they look like it's almost like a little boundary in a circle fashion. That's kind of what your ovaries look like, and that's primarily because of the hormonal effect that the condition has on your ovaries, as well as what the hormonal effect your ovaries has on the condition. And so this is where it can get a little difficult to grasp, or it's easy to become confused about, the chicken or the egg, pun intended. So with that being said, other parts of the diagnosis include if you have a hormonal imbalance where you have signs or confirmed lab results indicating that your androgen levels are up. Androgen levels meaning, the most simplest way to put this would be your male hormones. And women and men both have male hormones and female hormones, usually testosterone and estrogen. It's just what makes us women, what makes them men is who has more of what. We're not really supposed to have as much testosterone as men. In fact, I would say we probably have a fraction of the testosterone as men do, and part of the reason why our sex drive is not as high as theirs, but a different story for a different day. So with that being said, when there is signs that your testosterone levels are, or your androgen levels are, because there are different forms of testosterone, are elevated, then that is another part of the diagnosing process. So an appearance of your ovaries having multiple cysts in the periphery, or polycystic, there are signs that you are exhibiting extra androgens, and how that would manifest would be you are having acne, excessive facial hair, there could be hair loss on the head, or male pattern balding, and sometimes it can also fertility. But going back into how it can affect you on a quality of life level on a day-to-day, those androgen levels can create acne, they can create excessive facial hair, and then the result of all of this, or what triggers, we need to hold on to whatever fat we have, because what if something bad happens? I hate to bring it down to that level of simplicity, but essentially, when you are having an inappropriate insulin response, that's what's going on. Your body is having a response to normal situations as if you were being chased down by a mountain lion, okay? And then more and more and more insulin is required for you to be able to clear blood sugar and get it out of out of your blood vessels. So why is this all important? Because the normal response is you eat something, your sugar goes up, your body's smart, it releases insulin. Insulin tells the sugar to go into the cells, you clear the sugar, everything's great. With with a insulin resistant pattern, or what is kind of seen in diabetes as well as in PCOS, is that no matter how much sugar is in your bloodstream, it takes more and more and more insulin to clear it, and your body is not responding to the amount of insulin that's coming out. It is needing more of it to get the clue, like, oh, we should probably clean our side of the road. And this is what causes such a hard time for women with PCOS to lose weight. Which, if you've ever been to a gynecologist, the first thing they tell you when you're diagnosed with, or even thinking about polycystic ovarian syndrome, is, well, you need to lose weight to correct your PCOS. And it's like, but I thought that makes it harder for me to lose weight. So how am I going to lose weight to correct my PCOS, which is making me unlikely to lose weight, or it's giving me, a run for my money in everything I'm doing? And so this is where, I swear to God, we're not like trying to mess with you, but gynecologists are right too. It is going to help with your polycystic ovarian syndrome. Weight loss will help, not you creating that weight loss. Just in general, weight loss will help. And part of that is because our adipose tissue, or our fat, actually makes us more likely to have insulin resistance, which is part of the reason why we have this issue, which then leads to more of the weight increase and fat deposition, which then leads to more of the insulin resistance. Tracking what I'm saying here? And so the whole chicken and the egg thing, it doesn't even matter at this point what came first. The reality is that a woman who has or is showing signs, even without the diagnosis, of polycystic ovarian syndrome, most likely will have a tough time menstruating regularly because of tough time ovulating regularly. She will have a hard time controlling her blood sugars efficiently. She will most likely be insulin resistant, or to the point of developing diabetes, because PCOS patients are at an increased risk for diabetes. She will most likely be overweight. She will most likely have excessive facial hair. She will most likely have breakouts long past the teenage years, where they're socially still not the most acceptable. And none of this is guaranteed to happen like in bullet points. It's not like 1, 2, 3, 4, all of this happens, therefore you have PCOS. It could be any of these things, and the diagnosis is made usually with 2 or 3 of these things happening, including an ultrasound confirmation of the way your ovaries look, and your menstrual irregularities. But even if you don't have that, other little tip-offs can still indicate that you are one of those people that's sort of under the radar but still have this metabolic discrepancy, I guess you can say. And so this is part of the reason why losing weight is important, if not to reverse PCOS, at least to stop it from progressing. And then the question comes, well, how am I supposed to lose weight if it's so challenging with PCOS? Well, it does require specific kinds of weight loss efforts. Primarily, and I'm always, I'm a huge believer in, you don't lose weight with exercise. You lose weight with diet. You build muscle with exercise. But then that subsequently will help you lose more weight, because if you're more muscle, then you are burning more calories just existing. You have horrible gas mileage, and we want that, because we want to be able to burn more calories from just doing the same thing we were otherwise. And you create that with increased muscle. And my friend Ashley with Level Up Strength and Nutrition will definitely corroborate this. But going back to what we're talking about, a way a PCOS or a patient who may be showing signs of PCOS without the formal diagnosis, and frankly, everybody, the way we should really be eating, our diet should be very cognizant of how much sugar we are consuming. Not carbs, we're not talking Atkins, not, how much real sugar or like organic sugar. Sugar, 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 sugar. And fruits have sugar, vegetables have sugar. Obviously, the stuff that we're eating that's processed has a lot of sugar. And the reason why we didn't realize how much sugar we're eating is because somewhere along the lines, maybe in the 80s, I think, we got onto the whole fat-free craze. And the way they make food taste good when it's fat-free or low fat is by pumping it up with sugar. And hence, we have a nationwide, I don't want to say epidemic because that's a little extra, but most people are overweight or if not obese, and that leads to the increased risk of insulin resistance and then you just keep going. So how do we, as I was going to say, or as I was saying before, what kinds of food you eat is very important. You want to stick to foods that are low glycemic index, meaning the amount of blood sugar that is released from eating that food per unit of time is very low. It doesn't mean it doesn't have a lot of sugar in it or it doesn't have a lot of carbohydrates in it. It just means that in order for your body to be able to break it down into the unit of sugar that we use, which is glucose, it takes longer. And that's good because that's kind of like saying when you're getting on the high blood sugar levels, everything is kind of chill. And that's a state you want to reinforce. So when you are not sleeping or when you're chronically, sleep deprived, you're increasing your chances of developing these conditions like insulin resistance, polycystic, if you're a dude, then, obesity and or various other potential cardiovascular disease because of that response or that stress and fear-based response. Drinking lots of water, again, one of these things where you are able to allow your body anything. It may in the long term improve your symptoms from PCOS like acne, excessive fat. Overcoming it, you're then able to actually address your PCOS. Chicken or the egg. All right. That was a lot for whoever actually tuned in and is still listening. I hope this was informative or at least wasn't too complicated / confusing. And if you have any questions or if you would like to learn more, you are welcome to visit the GAYA Wellness platform, which is GAYAWellness.org. It is as simple as making a virtual consultation. You don't have to leave your home, take time off from work, or try and find childcare. You can do this while you're on a lunch break at work or at school or at home. And we can have an in-depth discussion, a full workup, including blood work and imaging orders, and then really kind of get down to what needs to be done to get you back on track. We also have a weight loss program that is really specifically, for women who are having these metabolic issues because they're hitting that phase where your ovaries start to kind of do whatever they want, whether it's because they're insulin resistance, PCOS, or even approaching menopause. And those situations warrant a different way of losing weight, and it's not just as simple as eat less, work out more. And so that's the whole premise behind it's not you, it's your metabolism. It's true, it's not you, it's your metabolism. We can do something about it. So if you want to, you can visit GAYAWellness.org, schedule a virtual consultation, and we'll get to the bottom of this. And for everything else, there's MasterCard. Actually, American Express. All right, guys. Thanks.